Moving forwards, the second speaker is Dr. Esther Yeo. Dr. Esther Yeo is a senior consultant at the Diabetes Center at Khoo Teck Puat Hospital, located in the Admiralty Medical Center. And this provides holistic and multidisciplinary care to people with complex diabetes. Dr. Yeo is a strong advocate for patient education and empowerment in diabetes management and leads the Type 1 Diabetes Education Program and Patient Support Group. And she will share with us a topic that is why we're having this. How does COVID-19 impact diabetes, and how do you live with diabetes in the midst of COVID-19?
Okay, thank you very much, Kevin. Okay. So I just have to say that while I'm sharing my slides, my tablet doesn't support the video on at the same time. So I'll see you at the end of my presentation. Okay. So hello, everyone. Thanks for joining us today. And thank you to Diabetes Singapore as well as Roche for organizing this webinar. It's really good to join my friends Jyoti as well as Fadzil in bringing you this webinar. Okay, so before we start, I know that we have friends not only from Singapore but from around the region who are joining us today. And I want to clarify once again that some of the slides are used mainly in reference to Singapore. So the circuit breaker can come in many different names. It can be a lockdown or a quarantine, but the intention is to reduce the community transmission of COVID-19. And to date, we have more than 17,000 people infected with COVID-19 in Singapore. And as of yesterday, we have 15 fatalities, which gives rise to the mortality rate, as we heard earlier from Dr. Jyoti, of about 0.1%. Now, our circuit breaker measures started since the 6th of April, was initially planned to end on 4th of May, but it's now extended for a further 1 month to the 1st of June. So sometimes it feels as if we live in very different times. We may have led very busy lives before this, but now the shops are closed, streets are deserted, schools are closed, and suddenly it feels as if the world is temporarily closed. And I'm sure that many of you would also have seen really funny cartoons about life during the circuit breaker or quarantine, whether it's about toilet paper or having really long hair as hairdressers are all closed, or gaining weight at the end of it all. So I want you to pause for a while and ask yourself, how is the circuit breaker affecting my diabetes? You may be working from home and snacking more at home. You may be more sedentary because you're not walking around in the office or not walking from the MRT to your workplace. And all these can lead to weight gain as well as higher blood glucose levels. Social distancing measures can also affect your exercise plans. Gyms are closed, group exercise classes are also closed. And there's definitely less interaction with your extended family and friends. And this may also once again lead to weight gain and higher blood glucose levels, as well as have an effect on your mood. Is there such a thing as a circuit breaker for diabetes? Can I take a break from my diabetes for a while? Well, unfortunately, no. But I hope that you will take it as an opportunity to learn new things and perhaps adopt healthier habits to keep well during the circuit breaker. And we will look at ways we can do this over the next 20 to 25 minutes. Now, before we do that, let's think about why it's important to look after your diabetes. Does having diabetes increase the risk of getting infected with COVID-19? Well, actually, the answer is no. A person with diabetes has the same risk as the general population in getting infected. But diabetes does increase the risk of having more severe disease if infected by COVID-19, which means a higher risk for hospitalization, for more severe lung disease or pneumonia, and even for admission to the intensive care unit or ICU. Most of you have also asked why the increased severity of COVID-19 in diabetes. Now, we've seen from the data that 10 to 20% of those with COVID-19 have diabetes, and the other important comorbidities, as we heard earlier from Dr. Jyoti's talk, are hypertension and heart disease. Patients with diabetes have up to a 2 to 3 times higher mortality rate than those without diabetes. And this is because diabetes, especially in the presence of poor glycemic control, where the blood glucose is chronically high, leads to an impaired immune response to infection. And therefore, this increases the susceptibility to all types of infections, viruses, bacterial, and others. And the risk factors for poorer immune response, as you mentioned, is diabetes with poor glycemic control. Diabetes also can come hand in hand with obesity. And obesity, like diabetes, is a condition of low-grade chronic inflammation, which impairs the immune response. Now, obesity, especially in the presence of severe abdominal obesity, where the stomach is distended all the time, can increase the risk of respiratory or lung conditions because the lung bases are not able to expand fully due to the increased abdominal obesity. And this increases the risk of infections in the bases of the lung, and it also reduces lung capacity. Diabetes, when poorly controlled over a long period of time, can also have additional complications like diabetic kidney disease or heart disease. And this can increase the severity of certain infections. So what can I do to better care for my diabetes during the COVID-19 and circuit breaker period? Now look at this cartoon here. You see in week 1, the man on the left is rather overweight, but at the start of the quarantine period, he buys a lot of exercise equipment with him. And he emerges from his flat 4 weeks later looking more muscular, trim, and fit. The man on the right, on the other hand, is looking muscular initially and must spend quite a lot of time in the gym. But he buys a lot of snacks and chips to while away his quarantine period, and he emerges from his flat 4 weeks later with quite a belly. So I hope that we will all be more like the man on the left. So over the next few slides, we'll be looking at how to maintain our physical and mental health in terms of food, exercise, blood glucose monitoring and medications and equipment, sick days, and what to do about your clinic appointments. So first of all, let's look at measures we can take to keep physically healthy, looking first at food. Now, mindful eating. Mindful eating means being more conscious of the food that you're putting into your mouth, to eat slowly and savor your food. And this is especially important when we are bored, stressed, tired, distracted. So be mindful to choose healthier snack options. Next, we should have a meal structure or plan. Eat more home-cooked food and plan your meals and snack times. Separate out your eating and working areas. This is because distraction can lead to more snacking and less mindful eating. So clear away work when having your main meals. Now, out of sight, out of mind. Now limit purchase of unhealthy snacks so that you're not always thinking of that bag of chips sitting in your food cupboard. And keep your blood glucose meter or glucometer in your line of vision so that you can remember to check your blood glucose levels. Now, some of you may tell me that out of sight, out of mind is easier said than done when you're always bombarded with food photos everywhere. All your friends are also working from home and trying out new recipes, and this may be flooding your WhatsApp group chats or all your Instagram or Facebook. And I'm sure you recognize some of the famous recipes here, the coffee dalgona on the upper left, or some Japanese cheesecake. But I can also easily say that amongst all these photos, you will always find healthier options. Homemade dumplings, noodles with lots of vegetables, or homemade buns with whole grain wheat instead. So mindfully follow the healthier choice recipes. I think the latest measures for the circuit breaker also support healthier choices. And this is because all the F&B establishments that only sell sugary drinks and desserts are no longer allowed to operate during the circuit breaker period. In planning your meals, ask yourself, what is your aim? Am I aiming to lose weight? And if so, how much weight do I aim to lose? An example shown here is if the aim is to lose, let's say, 0.5 kilograms per week. Now, in order to achieve this aim, in the diet, you must have a bit of a calorie deficit. And in the physical activity, you must have additional calories lost. And this will help you to achieve your weight loss goal. Try as much as possible to have a healthy, balanced diet, which will also help to boost your immunity. Choose whole grains, more vegetables, take grains, fruits, and milk. only based on your requirements. Now choose healthier oils and fat sources and ensure that your diet is low in refined and simple sugars. Learn to read food labels when grocery shopping. So for instance, look at the energy, which is the kilocalories, the amount of fat and saturated fat, carbohydrate, dietary fiber, and the sodium content. And remember that gram for gram, fats and alcohol carry much higher calories. So for one instance, one piece of banana fritter or goreng pisang at 65 grams, which is deep fried, comes in at a whopping 200 calories compared to one piece of banana of the same weight, which comes in at 80 calories. So the more calories consumed, the more the weight gain, and the harder it will be to lose the weight. Now, meal planning promotes healthier choices as it reduces the need for sudden decision making, which when on impulse tends to be unhealthy choices based on your food cravings. Meal planning also makes your weekly grocery shopping easier. So for instance, if we look at on the left, you see a 1,200 kilocalorie meal plan, which incorporates 3 main meals and 2 snacks, as opposed to a 1,500 kilocalorie meal plan. So here the difference is in the portion of food allowed. For lunch and dinner, you see half a bowl of rice for the 1,200 kilocalorie meal plan, as opposed to 3/4 bowls of rice for the 1,500 kilocalorie meal plan. In terms of physical health, exercise is a very important component, which Dr. Fadzil will be looking at in greater detail. So I will not go in depth into this topic. I wish to say that there is now a wide variety of online fitness classes and app downloads which are free during this period of time, or YouTube exercises which you can safely follow from home. And I've just listed some of my favorite apps as well as online classes here, which offer a wide variety of exercises. And the advantage of exercising from your own home is that it is at the comfort of your own home. There's none to minimal exercise gear needed. You can blast your own choice of music and there's no one judging you. The disadvantage is mainly for those who prefer group classes. But even then, there are now group Zoom fitness classes where you can still see your exercise buddies and you can still exercise together. We've also received questions about fasting for Ramadan. Now, I know that Ramadan is a time for social gatherings, so people will have to remember that this Ramadan may be a little different from previous ones. But I've seen people are also getting more creative by having Zoom or online gatherings, especially with extended family during the Buka Puasa period. And you will be into your second week of fasting now. So once again, meal planning and to choose healthier food choices. Avoid foods that are carbohydrate rich or that have high refined sugars. In terms of exercise, light and moderate exercise is safe, but vigorous exercise is not recommended because of the risk of hypoglycemia. Blood glucose monitoring, we would advise you to monitor before sahur, between 12 to 5 p.m., before iftar, and at bedtime. Always stay well hydrated. If you're not on any fluid restriction, to have at least 8 glasses of water between iftar and sahur. And you can see the proposed timings for staying hydrated. For your medications, some medications would need to be adjusted for Ramadan. The dose may need to be reduced or the timing switch from morning to evening medication. But all this should be on the advice of your healthcare team. Now, blood glucose monitoring is another important aspect of managing diabetes well. Blood glucose testing ensures that you keep track of yourself. And this is especially important during illness. Why? Because illness can affect your blood glucose levels and your ability to manage. Illness can result in variable blood glucose levels, both highs and lows. And when you're sick, sometimes you don't have much of an appetite. And this can increase your risk of hypoglycemia, particularly if you're on certain types of medications. So keeping track of your blood glucose levels and recording it down into a book or into an app helps you to keep track of yourself and see patterns in your blood glucose levels, which can guide you and your doctor on how to adjust your medications or insulin doses. So for instance, in this record here, you see that This person has recorded pre-breakfast, pre-lunch, and pre-dinner readings on 3 separate days. And you can see at a glance that the pre-lunch readings are tending to be on the lower end of the spectrum with 1 episode of hypoglycemia or low blood glucose. And so this perhaps suggests to the patient and the physician that they will need to adjust the morning medication. In terms of medications and diabetes equipment, it's important that you have a regular supply of your prescription, medications, and equipment, which will include your needles, lancets, and glucose test strips. Now, the elderly and frail may have limited mobility and are particularly vulnerable. They may not be able to have access to these medications or the clinics, so carriers can deliver medications to them or opt for home delivery of medications offered by some hospitals now. It's also important that people with diabetes do not overstock port medications or equipment to ensure supply for everyone during this period of time. Now, during sick days, we mentioned that we can expect the blood glucose to be more variable. This is because your stress hormones are activated, and this can result in hyperglycemia or high blood glucose levels. Now, when stress hormones are activated, it releases stored sugars in your liver, and this pushes the blood glucose up in order to fight the infection. At the same time, when you're sick, you can have a poor appetite, and this can increase the risk of hypoglycemia. As such, it's important to check your blood glucose more frequently and to stay well hydrated. In terms of medication-specific advice for sick days, this will need to be individualized with your doctor. In general, if you're unwell with fever, poor appetite, or if you're hospitalized, certain medications will need to be stopped. For instance, the SGLT2 inhibitors, which are medications that end with the term gliflozin, and sometimes metformin will also need to be stopped. Certain medications may increase your risk of hypoglycemia, as we mentioned, and so this will necessitate more frequent blood glucose testing, and the doses will also need to be adjusted. For instance, sulfonylureas like your glipizide, or glimepiride, and insulins as well. Now let's review some of the symptoms of hypoglycemia or low blood glucose. You may experience cold sweats, feeling hungry, feeling tired, weakness, trembling, shaking, blurred vision, confusion, palpitations of fast heartbeat, or even anxiety and irritability. So if you do recognize your symptoms of hypoglycemia, the first thing that is important is that actually you confirm that it is a hypoglycemia by doing a finger prick blood glucose test. And if it is less than 4, then you would treat with any of the following: half a can of regular soft drink, or half a glass of fruit juice, or 3 sweets, or 3 teaspoons of honey. And to check the blood glucose 15 minutes later to ensure that the blood glucose is now above 4. If it is still less than 4, then it's important to repeat the treatment. After the episode of hypoglycemia, it's also important to ask yourself why it happened so that you can take steps to prevent another recurrent episode. Sometimes medications will also need to be adjusted. This is a sick day flowchart for insulin-treated diabetes on sick days. Okay, on the left in blue, you see for type 2 diabetes, and on the right in green for type 1 diabetes. As we mentioned repeatedly, blood glucose testing is important. Now, in type 1 diabetes, there's the risk of precipitating a diabetic ketoacidosis or DKA at times of illness, and therefore sometimes ketone testing is needed. And this will require the use of a special ketone meter. Based on the blood glucose levels, additional correction insulin doses may be needed. It's important to stay hydrated, so continue to take sugar-free liquids at least 100 ml per hour. And in order to avoid DKA, insulin, sufficient fluids, as well as carbohydrates are needed. If your appetite is not so good and you're not able to take your meals as per normal, then you can take other carbohydrates as meal replacement. For instance, like porridge or something that's easier to swallow. And when is it important to seek medical attention? If you have recurrent episodes of hypoglycemia less than 4, even after adjusting insulin doses, or recurrent episodes of hyperglycemia or ketones are persistently present. If you have severe vomiting and cannot keep fluids, food, or medication down, feel extremely unwell, or have symptoms or signs of diabetic ketoacidosis, such as nausea, vomiting, abdominal pain, rapid breathing or breathlessness, drowsiness, confusion, or weakness, or any sign of dehydration, such as increased thirst, dry mouth, reduced or no urine output. We've also received questions about whether keeping your diabetes appointment at this point in time and having a blood test such as your HbA1c, is it necessary during this period of time? I would say that it really depends. Yes, you should keep the appointment if you have new symptoms or issues to discuss, or you feel that your blood glucose or blood pressure that you have been monitoring at home has been higher or lower and you need to know how to adjust your medications. In fact, it's best to seek help early if you notice that you are unwell and not sure what to do than to end up with a diabetes emergency. On the other hand, it's okay to postpone the appointment if you feel generally well with no new symptoms. You're monitoring your blood pressure and blood glucose at home and it's generally staying within your target range. And some doctors or clinics will be doing teleconsults or phone consults during this period of time. So do discuss this with your healthcare team. In terms of other specialist clinics, polyclinics, family doctor clinics, they're all open, but non-urgent clinic reviews may be postponed. So do continue to keep in contact with your healthcare team. If you are pregnant with diabetes, antenatal clinics are ongoing, and I would urge you not to postpone these. Emergency departments are open for essential emergency visits, and do not delay seeing your doctor or going to the A&E if you're unwell, as clinics and hospitals are able to care for you safely during this period. Now, as we mentioned, during this COVID period, everything we learn is changing, evidence is developing, and it's also important to keep mentally and emotionally healthy. Not everything you read may be true, so I would recommend to listen only to trusted sources. Sign up for the gov.sg, Telegram, or WhatsApp updates. And sometimes, if you find all the information overwhelming, do take a break for a while. Stop clicking on all the news feeds on your Facebook or group chats. There's also a lot of uncertainty and worry. It's okay not to be okay all of the time. Now, some of us may be feeling very different emotions. Some may be feeling fearful, sadness, overwhelmed, bored. Perhaps you feel a sense of isolation. It's okay to have these feelings. Now, the first step to do is to accept the emotions that you may be feeling and to talk about them to your support system. The support system may be your family, your friends, close neighbors, or even your healthcare team. Accepting these emotions gives you an opportunity to receive the support and the help that you need. And take a mental inventory. Now, ask yourself what has helped you to cope with these feelings in the past and what could possibly help you now. So look at the cartoon on the left. It could be as simple as ordering your favorite takeaway once a week, although I hope that it's a healthier choice option. It may also be listening to your favorite music, meditation, or gathering together with friends online, or reading your favorite book. Avoid alcohol and other harmful habits. Take healthier habits instead, like exercise, which can help you to release your feel-good hormones and makes you feel healthier as well. Now, there are lots of support groups. I've just listed some of them here as reference. There's diabetes support groups like Diabetes Singapore, Touch Diabetes Support, or Facebook groups, as well as other national level hotlines. So in conclusion, these are my key take-home messages from my talk. Now, these are really challenging times for everyone, the public, us, the healthcare professionals as well, and patients alike. Everything we learn is constantly changing and evidence is developing. New data is coming in all the time, so do continue to stay updated from trusted sources. Now, keep physically healthy through healthy eating, physical activity, frequent blood glucose testing and blood pressure monitoring to ensure that you stay on track. Build a support system around yourself and stay mentally resilient. And discuss sick day rules with your healthcare team. Know that on sick days, you may need to test your blood glucose more frequently and know when to seek help from your healthcare team. So thank you very much, and I would be happy to take any questions later on.
Thank you, Dr. Esther Yeo. All of us are affected by COVID-19 in one way or another, and people living with diabetes have more challenges on their hands. And so again, it's good to hear from an expert about how you deal with your diabetes and live with your diabetes in these challenging times.